Hi, are you going to the emergency department? If you have a medical emergency, please dial 911 immediately. Do you have chronic pain issues or are you moving to another state? Here are some things you need to know about pain management in the emergency department. Number one, most emergency departments are very unlikely to give you a refill on any controlled substances you are currently taking. In other words, we are not a substitute for your primary care provider or your chronic pain management specialist. If you have a need of narcotics, you need to coordinate with whoever is prescribing those medications to you. Number two, make sure you keep track of your prescriptions. If the emergency department or anybody else has given you a prescription for pain management, make sure that you get those prescriptions filled as soon as possible. That way, you don't lose them. If you do lose them, it's not the emergency department's responsibility to refill that medication for you or to give you another prescription. Number three, if you're planning to move to another state and you have chronic pain management issues, it is extremely important that you coordinate with whoever is currently managing your pain and coordinate with them to transfer your care to the new state. That way you don't have a lapse in your pain management therapy and you don't end up in the emergency department asking them to, quote, bridge the gap, so to speak, on whatever pain management therapy you're out of. So make sure you coordinate your efforts and have plenty of pain management so that when you get to the new state, you're not without pain management for a few days. Number four, do your research. Some states take a long time to get you in with a chronic pain management specialist. Some states take up to 6 months, and the emergency department cannot give you a referral to those clinics. You need to establish with a primary care provider who can refer you there. So make sure that you coordinate your efforts and do your homework on how difficult the new state you're moving to can be as far as getting you in with a chronic pain management specialist. And number five, talk with your insurance providers. It's really important to know which insurances aren't going to move state to state with you. That way you know what you're covered for. So it's extremely important to do this homework before you move to the new state because you don't want to go into an emergency department where we're unlikely to give you any pain management. Most of the narcotics or controlled substances patients are on for chronic pain management therapy is so large that most providers do not feel comfortable giving you a refill or even a couple days worth of pills to get you through to your next appointment. So make sure that you coordinate your efforts so that you're never in this situation. Thank you so much for your time and have a great day.